How you doing? I'm Dr. Justin.
How you doing, Carl?
Nice to meet you. Today we're going to be doing a general scan. We're going to be evaluating your spine from the back of your neck down to about your belt line. If I need to expose any skin in that area, that'd be okay?
That's fine.
All right. Go ahead and remove your shirt from you. Check this table. Have a seat facing in that direction. First, we're going to check the SI joints by bisecting. Get the iliac crest, windshield wiper down, find PSIS, and then with my indifferent hand, brace the patient and assess the joint at a 45-degree angle. And then beginning in the lumbar spine, I'm going to go from posterior to anterior. Check each segment of the spine for proper motion. I'm going to use my indifferent hand. I'm going to brace the patient's head. Go ahead and flex forward for me. And with my thumb and index finger, check each cervical segment, starting off going superior to inferior, and transitioning from posterior to anterior, and then going from inferior to superior. Okay, next we're going to evaluate the L2, L3 segment by bisecting at the iliac crest, coming in to the L4. Palpate superiorly 2 interspinal spaces. Let's switch sides here. Go ahead and cross your arms forward. We're going to check rotation, lateral bending, and flexion. Flex forward for me. Feeling for the spinous process to separate. I'm going to change my contact point to my thumb on the side of the spinous process. Go ahead and check for rotation. And check for lateral bending. Next, we're going to check the T8, T9 segment. I'll find the inferior aspect of the scapula. Go ahead and bring your arm behind your core. Okay. Come straight over. Get the T7. Palpate inferiorly 1 interspinal space to T8. Cross your arms. Switch sides. Again, we're going to check for flexion. Switch my contact point to my thumb. Check for rotation. Bring the joint to pretension and spring through. And lateral bending. Repeat the same thing on the other side. Pretension, spring through the joint. And check for lateral bending.
And what's your line of drive for these movements?
On the lateral bending, it'll be lateral to medial, as well as rotation. Next, we're going to check the ribs for the same T8, T9 segment. And palpate up 2 interspinal spaces. Tissue pull out laterally 2 inches. Rotate this way. Push superiorly check for elevation of the rib. And down, push superiorly or inferiorly on the superior aspect of the rib. Check for depression. We're going to check your right SI joint, so if you'll lay down, face down for me. Is it okay if I touch your pressures? Find where the ilium and sacrum meet. Place my fingers in that joint line. Palpate for the ASIS and pull superiorly to assess the joint play for flexion. Contact the left ASIS. Same thing, superiorly to check for extension. Alright. Everything felt equal, so it is a healthy SI joint.